Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Wellcast Nation, welcome back. We got Dr. Bev in the mix today. She is a child psychologist up in Guelph, and she reached out to me, which I'm super grateful for. We have a mutual friend in Lauren Follett, and basically just wanted to comment on what she's seeing with the kids as a psychologist, how we address anxiety, how as parents we deal with the strong emotions that our kids are going through right now during these, unprecedented times, with the emphasis of, we got to take care of ourselves before we're able to take care of our kids, and just given that lens of self-compassion for parents. I think you guys are going to really enjoy this episode. Before I jump into it, don't forget about Solving Wellness, solvingwellness.com, to be able to link up with us where we're doing online workouts, online yoga sessions. We're doing virtual cooking classes, nutrition tips, all this to try and reduce burnout amongst our healthcare providers. So go to solvingwellness.com. Check it out. Yeah. So without further ado, let's check it. Dr. Bev. Quadcast Nation, listen, we have a fantastic guest today who reached out to me on Instagram. Sometimes I love social media. Sometimes I hate it. But listen, Dr. Bev is on the show today, child psychologist out in Guelph. And frankly, she's changing the boogie, people. She is having these frank discussions about how we get our kids through these tough times. And so, Dr. Bev, thank you so much for joining us on the show.
Thank you. It's such an honor to be here.
Absolutely. So what made you reach out? Like, you know what I'm saying? Like you're a clinical psychologist, child psychologist, great, expert in the field. And, something drew you to want to speak more about some of the stuff you're seeing. So what drew you?
Well, I just loved that the messages that you were sending, at least the ones that I was kind of late to the game to catch on to even know who you were. And when I did, when Lauren Follett introduced me to you, I thought, okay, this is really interesting because Dr. K seems to be somehow blending or merging these two very polarized views. One is, COVID doesn't even exist, forget it, don't have masks. And then the other side is like, let's tighten up, let's be super controlled, let's be very careful. And I liked that you were like, well, let's look at the science and what makes sense. And let's look at this holistically for how these restrictions and the things that we're doing collectively as a society are impacting, especially our kids in the longer terms. Let's look at things like mental health outcomes, socio-emotional development, and some of these other factors that I think we're not realizing kind of the huge consequences and impact that's going to have if we keep tightening up with our restrictions. So I just like that you were bringing in experts, you were looking at the science, you were looking at the data, and kind of saying to everybody, like, frankly, there's not enough data to suggest that this is a good idea for our kids ever, but especially anymore. Let's move on.
Oh, well, I'm very grateful for the kindness and for you reaching out, because Bev, I want to hear what you're seeing, like, because obviously if you were seeing the negative impacts of some of our approaches, that must have drawn you to want to act or say something. So, like, what are you seeing in your either in your kids or your parents, whatever you want to comment on first?
Oh gosh, that's a great question. It's a big question. Maybe I'll try to break it down almost by demographic. So parents-wise, what I'm seeing mostly are confused, stressed out, frustrated, worried parents who obviously want to put their children's best interest in mind, but have so many pressures and factors and demands on their shoulders and are feeling like they're failing. Myself included, it's been really, really difficult to have a career and balance all the pressures of, teaching at the university, having private practice. I'm canceling people all the time in terms of appointments because at the last minute I have to be home with my kids. It's really hard to balance. Mm-hmm. And it's really hard to reconcile all the different messages that are being given to us all the time. Like, it's confusing. One day I'm feeling like I really need to be so strict and controlled and, oh, no, you can't see your grandpa because you have a cold. And the next minute I'm thinking, this isn't good for you. We should just go out and have fun. It's just been so confusing. So I feel for the parents who don't really know what to do, don't know what the right thing is anymore, and are stressed themselves. And of course, then they know that's impacting their kids.
100% with I see where you're throwing down with the parents. Like, I mean, you must get these messages all the time. I get these messages all the time, what to do, how to handle specific things. And I think one thing that, I've heard a lot of psychologists say is, you need to be able to have that foundation. Like, you need to be able to take care of yourself to be able to take care of your family. I don't know how you feel about that.
Oh my gosh. I'm a huge proponent for self-care. People know me kind of as back in Vancouver, I was known as Self-Care Fridays. It was my thing to just have a Friday to go to yoga, whatever. Now I have kids. That's actually not possible anymore. But I try really to make sure I'm putting my own oxygen mask on first. And that's because I know that if I feel well, if I'm taking care of myself, if I'm sleeping, if I'm eating, if I'm doing my own mental health work, if I have some meditation in there, if I'm seeing some friends, whatever your self-care is, if I'm taking care of that, then I can take care of my kids better. And I'm not having the mom guilt. I'm not feeling like the time I'm spending with them, I'm distracted and I'm multitasking and I'm frustrated and I just can't wait for them to go to bed, which I know a lot of parents feel that way.
Amen.
And I have days like that. We all do, but you don't want to have every day be like that. Otherwise, it's just not fun. And these moments with our kids are so precious.
Yeah, I think that's a good point. And I'm guilty of that one, Bev, of, man, isn't it bedtime yet, boys? You know what I mean? Like, mommy, we need some mommy and daddy time. We need some time to decompress.
I know.
But it's a valid point, like really scheduling in. And that's why I always encourage those that can, like, schedule in that self-care time so that you can be as present as possible. Because right now, and I don't want to put words in your mouth, but our kids need us. This is what I'm seeing. Our kids really need our love, our attention right now because of, some of the impacts all of our restrictions have had on them. And so, like, in terms of the kids you're seeing, like, what's the common concerns?
Common concerns, a lot of generalized anxiety. Generalized anxiety has always been there. There's always an undercurrent. Like, I always see generalized anxiety in my practice, but right now it's showing up kind of like the anxieties they're more intense. There's a lot of what ifs to worry about because GAD tends to be that it's the disorder of thinking about what if something bad happens. Mm-hmm. And now I'm hearing like there's just so many what ifs of all the bad things that could happen. And I'm also seeing a lot more OCD, contamination-related OCD, right? So before, it was sort of a little bit unrealistic or maybe disproportionate the amount of threat that we would have to think about germs and how much germs would actually harm us. And now we've been taught for 2.5 years to fear germs and to fear any kind of transmission. And so I'm seeing that show up a lot with the OCD population.
Wow.
Yeah.
So OCD type stuff and general anxiety related. And are your volumes changing, or have they been pretty consistent throughout the your practice?
Volumes wax and wane. I would say, I think what's happening right now, to be honest, is that waitlists are actually either closed or so long that I fear that people are becoming defeated, because I do seem to get a lot of, like, I get sort of clusters of referrals, and then I won't hear anything for a little while. And I'm wondering, because the last several times people have reached out to me, I said, I have a bit of a wait list, and I worry that everybody needs to access service now. When you reach out as a parent for your child because your child is struggling or suffering, you want to be able to access something in 8 months. Mm-hmm. So that's a problem for sure. And I would definitely say volume. There's more patients. The struggles are more serious in a lot of ways. And I don't know what to tell people other than just keep going back to the people that you're asking to get on their wait list, and just keep asking and keep pushing, because if you need something, we need to get you some help.
Wow. Yeah, this is my concern. Like, we're good friends with a child psychologist, and yeah, the wait lists are ridiculous. She had to close her wait list, and this is my concern. And this is part of the reasons why I wanted you on, Bev, just to give some guidance for some of the, we talked about what parents need to do, but even when you have that kid that's having more anxiety, the OCD might be a bit tricky. I'll let you comment on that too. But like, what are some of the things that, when we're seeing early signs of, anxiety, maybe, I don't know if you're seeing much in the way of depression, but what can parents do to try and, offset some of these symptoms?
Yeah, that's a great question. So I think awareness is really key. So parents really need to pay attention to what are you seeing? What kind of activation, what kind of behaviors are you seeing from your kiddo? Are you seeing a lot of avoidance and withdrawal? Are you seeing that anything kind of hard or that they're fearful of, they just don't want to do and they're saying no to, or they don't want to try? Is there a lot of shutdown? Is there a lot of crying and a lot of tears and a lot of stress? Like, sometimes anxiety can show up and it doesn't really look like I'm scared, and they don't know how to say I'm scared, but it's showing up in some of the behaviors that might be a little bit more covert and a little bit difficult to decode. So parents, like, I do have a lot of parents who say, every night at bedtime, my kiddo tells me that they have a tummy ache. And then I'm up and I'm trying to convince them, like, you don't have a tummy ache. It just came on right now. Could that be anxiety? Yes, absolutely. That could be anxiety, because our fears, our worries, all of our feelings do tend to be expressed physically. And one of the words to describe that is somatization. We do tend to somatize, right, when we are feeling really stressed. And so sometimes kids aren't able to articulate yet how they feel, but they can describe what's going on in their body. So I really encourage parents to pay attention to the behaviors or the feelings that might be coming out from their kiddos, and to really be kind and gentle and curious when you're first getting started with kind of some of that the awareness, because to get frustrated with our kids, like, I understand why parents do, but to get frustrated, to threaten them, well, it's bedtime now, like, I'm sorry that you have a tummy ache, like, you got to get to bed. That kind of thing really can just exacerbate the struggles. So maybe we can talk, I don't know now or in a few minutes, about maybe some of the steps that parents can use, almost like what's called emotion coaching, where we pay attention to the feelings that we're seeing, and parents need to do a little bit more work to attend to the feeling without jumping to the solution.
I think this is a perfect time. And I'm mad curious about this too, because this is something that I can already see that I need to work on. So yeah, in terms of the approach to emotion coaching, how do we throw this down?
Okay, so a couple of steps that are really, really important. The first is labeling and identifying, right? So when you see there's something going on with your kiddo, let's say they're playing Legos and they're getting super frustrated, or they're starting to stall at bedtime is a really big one in our house, where I start to hear one more story, different blanket, like that kind of stuff. Maybe that can be a sign that there's a little bit of anxiety, right? There's something going on there for sure. So parents, it's okay to say, you know what? Like, I wonder if you're feeling a little worried. I wonder if you're feeling a little sad. Like, is that something you want to talk about a little bit? Or, you know, how's that feeling in your body if you are feeling frustrated or worried? You want to talk about that a little bit. Get them to describe it. Like, for a lot of kids, they need to draw it. They want to draw their worry bug or whatever it is that they're feeling. They want to describe it and visualize it. Like, kids are super tactile. They need to concretize things. They need to be able to make it like more accessible to them. Mm-hmm. And sometimes just talking about worry feels a little bit abstract. So I would say really try to make it clear for them and help them access that. Then after we identify and we kind of label, then we do a lot of work, parents, a lot of work, way more than you think you need to do. We need to validate what the feelings are. Mm-hmm. And we don't jump any further before we've really validated. Do you know what I mean by validate?
Like you just like acknowledge and be like saying like, that's okay. Like it's, it's okay to be anxious about X, Y, Z. You know what I'm saying?
Yeah. And even empathize. So like I'm doing a lot of, right now my kiddo's struggling to hear no. He really doesn't like the word no. It's a big, big problem. Like how dare we say no to him? So I'm saying things like, oh, it's so hard to hear no. I understand that it's really frustrating and hard. When I was little, and also right now, I really didn't like to hear no either. Right? Tough. It's really tough. So it's okay as parents just to really kind of get down on their level, literally get down on their level and empathize and validate and like be in that mucky emotion with them, because you don't want to go any further until they feel you've heard them and understood them.
Wow. This is gold right now. So like make sure they have that outlet to express themselves in whichever shape or form. And as you mentioned, tactile, that seems to work well, but also just validate, empathy, compassion towards your child. I'm taking notes right now, folks. Cause I definitely see this value. And I think this is golden in terms of really trying to address, some of the concerns of the kids. And it's nice to be able to have tools at our disposal, especially when, this is a crisis time, in my opinion. This is a lot of kids are going through this right now. So in terms of improving the awareness of the anxiety, in terms of, we called it emotional coaching, any other things that you feel like need to be addressed when we're dealing with this at home?
Yeah. So then the next piece, and again, this is kind of more for the kiddos, like this would be the population that I would almost describe as the worried well. So it's like you're in a place, parents, as a parent where you feel you can kind of handle and tackle some of this. So this is maybe pre-reaching out to Dr. Bev or whomever for some supports where you want to try some steps on your own. I would encourage you to try these steps. But again, these are general steps. This is sort of not individual, client recommendations that I'm giving, but these are general steps that can be helpful. I would say the next piece then, if your kiddo can tolerate it and you feel like their emotion is now coming down, the emotional wave has kind of gone up and it's now back on its way down, then you can engage in collaborative problem solving. Then it becomes, maybe there's a little negotiation, maybe there's a little bit of what might work to help you feel a little bit better. Maybe they do need a little bit of reassurance and some accommodations to help them feel more comfortable. And as a family, I would definitely say anxiety becomes a problem if it's impairing to the child and or to the family. If it's not a problem for the kiddo, but it is a problem for the parents because they're up 60 times in the night providing reassurance, then it's still a problem. So I would say just be mindful that we need to be able to problem solve. And sometimes within that problem solving territory, it becomes a question of how to help gradually expose and push that child to do something that's like pretty hard and outside their comfort zone, but that would be, for the greater good for them, their mental health, their physical health, and for the family's functioning.
Wow. So just almost like a gradual process, like almost trying to think of a good analogy, but for
The
whatever
ladder
reason,
hierarchy that you need to create with your kiddo, where they're like working gently and gradually up some ladder, up some stairs to get to a goal.
Wow. Yeah. And the negotiation piece, like it sounds like really should be a solution that is, realistic and not too prohibitive, like on mom, dad, and kiddo.
Right. Yeah.
But no, that's workable. That seems really workable. Any other pieces to that before I ask you about some of the OCD side?
I guess the piece I just really want, and maybe this is kind of our kind of end message, but I think parents really need to hear, if your child seems more anxious right now, maybe that's also a little bit okay, right? Like it's their nervous system trying to figure out and navigate all of the stresses and the threat and the fears and all the stuff and all of the times they've heard parents, worried about what's going on in the world at large. It's like kids, they are little people there, but their brains are still developing and they can't necessarily rationalize all the big information that we've been trying to help them understand or protect them from over the last few years. So if your kid has a little bit of anxiety, yeah, that's understandable. And maybe that's okay as long as it's, workable and you can help them through it.
That's a really good point. Because if you think about these are not normal times, right? No. And what we've downloaded on our kids, in my opinion, have been quite a lot. And when you factor that in, realistically, there's a lot of reasons for them to be anxious. Like tons of anxious parents right now. Anxiety is an anthem right now. We go on social media, go mainstream media. You socialize depending on people's level of COVID nerves. Like it's everywhere. You go to the grocery store, somebody, tries to avoid you because they don't want to get too close. Like it's society is screaming anxiety right now. And so it's a good point that we, once again, have that empathetic lens and, and realize that the kids are going through a lot. They're going through a lot right now.
Yeah. And and actually having a little bit of anxiety is a sign that they're trying to make sense of and figure out, how loud does my alarm system need to be turned on? Because it's up pretty high for a lot of people. It has been for a long time. And by alarm system, I just mean that our whole nervous system we're constantly sort of scanning for threat. That's what humans do. And we need to be able to kind of turn on that fight, flight, or freeze when we are faced with true threat. But at this point, it's almost like, where is the threat and how real is it? And for some people, it's still very much real. And for some people, it's not anymore. There isn't sort of real activated threat. So I just feel like we need to be patient as we help our kids through this process and recognize that if they're sifting through what threat to attend to, like I think that's a good process for them to be able to learn. Wow.
Yeah. I think that's a good point. Like almost role model that this is trying times, and we are working through this together, like how to navigate this level of uncertainty. Because a lot of people, I hear this. My wife brought this up the other day. Like you're always waiting for potentially the shoe to drop. Like you get signs of hope, and then before you know it, they're telling you. Like I think a lot of people, when you look at over the holidays, when Omicron hit, it was like, what? I thought we were, we're all vaccinated, we're all moving forward, and then this ultra contagious, variant comes along, and we're moving backwards. I think, there's always that kind of, is the shoe going to drop again? Or school's going to close again? Or, I think that's, I think this is a big driver of mental health concerns in our society right now.
Absolutely.
Yeah. And, but yeah, these are definitely challenging times. But and once again, Bev, I think I want to reinforce too, or maybe just ask you too, in terms of the parenting, being able to take care of ourselves and what have you. We talked about potentially, booking time for self-care and anything like that. Any other advice that comes to mind in terms of parents really making sure that they are taking care of themselves?
Well, you used a good word, compassion, self-compassion. Like, I think there's a lot of research out there to show the importance of using self-compassion, which is basically like being as kind to one's self as you might be to a friend, and really talking to yourself the way that you would someone else that you were trying to care for or take care of. So I think parents we maybe underestimate the importance of just being so kind to ourselves. Like one of the tips I'm giving parents these days is like, find one thing throughout the day that you feel you can do really well with your kid. Maybe that's like you're doing one really awesome meal, and then the other two, maybe you're doing more processed food or whatever because you kind of have to and you have time and you don't have the bandwidth. And that's okay. Like, use that time to be self-compassionate and to say, I'm really doing the best that I can. And actually, like, I really nailed breakfast. That was awesome. I got so many good things on that plate. I feel really good about that. It is about the small wins right now, right?
I love it. Just like celebrate the wins that you get, and just, create that confidence, create that, that self-compassion. Cause I think a lot of people need that right now. I think a lot of people hard on themselves in terms of whether that's expectations or whatnot. But I love that. You really just be kind to each other, be kind to yourself, and just acknowledging that these are not normal times.
Yeah, that's right. That's right.
Absolutely. So, Dr. Bev, this has been fantastic. I think this is super valuable for so many parents and their little ones. And so how can people track you down?
So you can just also Google Dr. Beverly Walpole. I'm in Guelph, and my website is Arbutus Psychology. Arbutus is a tree that's native to the Pacific Northwest. It's a very strong and resilient and hard tree, because when I started my practice, I thought I want to build really resilient people. And now I'm more like, no, let's just get by. Let's just be okay not being amazing right now, because it's just not the time to try to be just like crushing it in all domains. It's okay to be doing okay in a lot of domains right now. And we'll get there again. Like, we will really get there. But Arbutus, Arbutus Psychology is how you track me. Mm-hmm.
Fantastic. We'll put that in the show notes. Dr. Bev, thank you once again. I know we're going to do this again sometime, but really appreciate you taking the time and reaching out.
You're welcome. Thank you so much for having me.
Yeah. Thank you so much for joining us today. Follow us on Instagram, YouTube, Twitter, Facebook, TikTok at Quadcast. Leave any comments at quadcast99@gmail.com. Leave us that 5-star rating. You got to do it on iTunes or Spotify, wherever you listen to podcasts. Don't forget about Solving Wellness, Changing the Boogie, Reducing Burnout, solvingwellness.com. And we'll connect again real soon. We love you. Stay safe. Peace.